Hey everyone, welcome back to the channel. Today we're diving into something that might seem simple, but holds a wealth of clinical information: the urinalysis. Whether you're a med student, nurse, clinician, or just a curious mind, this one's for you. Urinalysis, or UA, is a quick, inexpensive, and non-invasive test that examines urine for signs of disease, hydration, infection, or metabolic issues. It's often part of routine checkups, pre-surgical workups, or diagnostic testing when symptoms arise. Urine reflects what's going on in the kidneys, liver, and even the rest of the body. Let's break down what we're looking for. A complete urinalysis has three parts: physical, chemical, and microscopic examination. First, the physical exam. Color: normal urine is yellow due to urochrome. Red, think hematuria or beets. Brown may be bilirubin. Cloudy, consider infection or crystals. Clarity: clear to slightly hazy, is typical. Turbidity could suggest cells, bacteria, or crystals. Odor: fruity smell might indicate ketones and diabetic ketoacidosis. Next, the chemical exam, the dipstick. Each test strip gives instant info on pH from 4.5 to 8. Alkaline can mean UTI or post-meal. Acidic could be a high-protein diet or metabolic acidosis. Specific gravity reflects urine concentration. Low means overhydration. High means dehydration or protein. Trace might be normal. Persistent proteinuria, think nephrotic syndrome or glomerular disease. Glucose is normally absent. Positive means diabetes or stress hyperglycemia. Ketones can appear with fasting, DKA, or ketogenic diets. Bilirubin and urobilinogen suggest liver or biliary disease. Blood on dipstick, that could be hematuria, hemoglobinuria, or myoglobinuria. Nitrites and leukocyte esterase point to bacterial UTI, especially gram-negative like E. coli. Third, the microscopic exam. Urine is spun in a centrifuge, and the sediment examined under a microscope. Cells, red blood cells, could come from the glomerulus or lower tract. White blood cells indicate inflammation or infection. Epithelial cells may suggest contamination or tubular damage. Casts, hyaline casts, can be normal or from dehydration. Red cell casts mean glomerulonephritis. White cell casts mean pyelonephritis. Granular or waxy casts suggest chronic kidney disease. Crystals, uric acid, calcium oxalate, cysteine, or struvite, these are clues to kidney stones. Bacteria or yeast can mean infection or contamination. Sperm or mucus are occasionally seen and usually incidental. Let's apply this in real life. For a urinary tract infection, you'll often see positive nitrites, leukocyte esterase, cloudy urine, and WBCs on microscopy. In diabetes, look for glucose, maybe ketones and DKA, and high specific gravity. Glomerulonephritis, think red cells, protein, and red cell casts. Liver disease might show bilirubin and urobilinogen. Rhabdomyolysis presents with positive blood on dipstick, but no red cells under the microscope. That's myoglobin. Kidney stones might show hematuria, crystals, and acidic pH. Urinalysis is powerful but not perfect. False positives happen. For example, dipsticks might detect hemoglobin from menstruation or myoglobin from muscle injury. Contamination is common, especially in women, so always interpret results in context. Want the best quality sample? Use a midstream clean catch. First morning void is ideal. It's the most concentrated. Test within 2 hours of collection. And avoid testing during menstruation when possible. Urinalysis might look basic, but it's packed with diagnostic potential, from infections and metabolic disorders to kidney function and more. Always pair results with the clinical story for the best interpretation. If you found this helpful, like, subscribe, and drop a comment below with your urinalysis questions or scenarios you'd like broken down.